Hey, 8 weeks ago from the time that I'm shooting this video, I actually tore the distal, or the end of my bicep muscle, my bicep tendon that attaches to my radius in my forearm. I actually tore that muscle, complete tear, confirmed by MRI 2 days later. And so I had obviously my dilemma was, do I get this surgically repaired? Typically when a tendon completely rips off of a bone, pretty much every orthopedist is going to say, well, you know what, you definitely need to get that repaired. You need to get that tendon reinserted into that bone in order to get normal or optimal function in that area. And so I started doing some research to try to understand, okay, do I need surgery for this? Or is this something that I can rehab naturally? And so I went to an orthopedist, and he recommended getting surgery done. And he said that this is probably the standard of care, that the best recommendation is getting surgery, because these kind of problems can cause long-term issues, and you'll never really fully gain your full strength back. And so I appreciated his advice. I did some research on my own, and I found that when it comes to the bicep does two major things. Elbow flexion, but there's other muscles like the brachialis that also do elbow flexion. That's what we typically think of with the bicep. It also does something called supination, which is basically if I were to take my hand kind of like I was drinking a cup, and I would turn it in, right, to where now my palm is facing up. That's called supination, that movement right there. So the bicep is a huge player in that supination movement. And so what the research says, if you don't get this repaired and you just rehab it naturally, you're going to get roughly 85 to almost 100% of your elbow flexion strength back. So your kind of bicep curl, you're gonna get at least 85 up to 100% strength back. With the supination, again, that movement where I bring my palm up, okay, so from a neutral position to bringing my palm up, you get about 50 to 60% of the strength there back. If you get surgery, you can get 95 to 100% of the elbow flexion back, and you get roughly about 80% of the supination strength back, so not even 100% there. So ultimately, we're talking about roughly 10 to maybe 15% strength improvement, getting surgery in the elbow flexion, and then about 20 to 30% strength improvement in that supination movement. And so I asked myself, is that worth it? It was my non-dominant hand, my left hand, I'm right-handed. So I asked myself, is it worth it to get that surgery done? And I actually watched several YouTube videos from somebody that has a channel that's called, and I'll put it in, in the notes for this video. It's called, Distal Bicep Tendon Rupture, no surgery. And he actually went through the process of not getting surgery and kind of goes through every single month, shows you different exercises he's doing, and shows you his progress. And I watched all his videos on his channel, and then I actually went into PubMed to look at the research. And what I found was that the most recent meta-analysis are kind of the gold standard when it comes to research. They group all, the top studies together. They get rid of studies that, don't qualify as, really good quality studies. And then they look at the overall results. And what the meta-analysis, particularly 2021 big meta-analysis said was that surgery is superior than non-operative treatments for the recovery from the distal tendon bicep injury. But I went further. I said, well, yeah, they're saying it's superior, but I want to see some other evidence. And so I found a study out of the Journal of Hand Therapy in 2021. It took 2 case studies, right? And it looked at this 48-year-old police officer who was very active, lifting weights, very active in his job, obviously, as a police officer, and then a 43-year-old detailer who was a little bit less active, but men in their 40s. And at the time I injured myself, I was 42. And so I'm in that people group. And both of these guys went through 24 weeks of physical therapy. No surgery, 24 weeks of physical therapy. And both of them were very happy. They had no major functional issues. All their subjective questionnaires, like of symptoms and things like that, they felt better, right? Now, the original meta-analysis actually showed the reason why they recommended surgery was that they found that flexion strength, supination strength, and overall patient satisfaction was better when these individuals got the surgery versus not getting the surgery. But when I took 2 individuals that kind of were similar age group as me, these 2 individuals here that were in this study, they seem to be very satisfied with not getting the surgery. And anytime you get surgery, there's always risk, right? There's about 1 to 2% risk of, in particular in that elbow region, of clipping part of the brachial plexus, which is huge amount of motor nerves. And there's a risk of having some sort of nerve-related issue, nerve-related damage that could occur. On top of that, when you get surgery, it actually slows your recovery. For example, the first 2 weeks after the injury, like I felt broken. I just kind of held my arm around like this. I always kept it in flexion because that's safe for the joint. I never wanted to put in an extension. I couldn't even do that because of swelling in there. And I just felt broken. And it was hard to, really use or do anything. I was mostly doing everything with my right arm. Towards the end of the second week, I started feeling, a little bit more open and just feeling better. And I was also getting some intensive physical therapy treatments with it as well. But during that period of time, you feel like you need surgery. And so for a lot of people, they go and they schedule the surgery, and surgery is best done within the first 4 weeks. After that, what happens is you get this really, really strong connective tissue that builds in there, and the surgery is a lot more complicated and complex, and there's a higher risk of problems when you get the surgery. So most surgeons say, okay, let's get it ideally within the first 2 weeks, if not the first 4 weeks. So if I were to get the surgery, and let's say I scheduled it a week out from the time I met with my orthopedist, that would have set my rehab progress back probably 2 weeks. So it would have taken me longer to recover. And so as I was reading through this research, I really wanted to understand, okay, what happens if I don't undergo the surgery? So a study I found was called the Clinical Face-Off, and they took all these top surgeons, orthopedic surgeons, and they had a face-off where they were, in a sense, were debating what are the benefits, operative versus non-operative. And some of the top orthopedic surgeons that teach and are leaders in the industry really almost convinced me, as I was reading that, not to get the surgery. In fact, Dr. Luban out of Pennsylvania, he actually talked about how he was part of a study where they took 16 patients, they did non-operative treatment, so just physical therapy with these individuals, and only 1 out of the 16 actually regretted not getting the surgery. So I thought, you know what, there's probably a good chance I'm gonna recover faster. In fact, with my understanding of natural health, nutrition, my resources when it comes to knowing other doctors that do advanced physical therapy, I think I can heal faster than most people and more effectively. And so I got several different treatments. One was called softwave TRT, and that was very helpful for reducing inflammation in the area, helping increase stem cell development in that region, and helping the connective tissue build faster. And I mean, really after about 3 or 4 weeks, I had very little symptoms at all. And I was back lifting weights with both arms. In the beginning, I was just lifting weights with doing one arm exercises, basically. But I remember around 3 weeks or so, I started actually doing dips, which uses an elbow extension, and actually felt really good doing it. And then after 4 weeks, I started doing, bench press. I started doing all different types of push exercises. And now at 8 weeks, I found that my push exercises, my bench press, incline, overhead press, weighted dips, I'm just as strong as I was pre-injury. When it comes to pull exercises like pull-ups, bent over rows, I have about, I would say from a bent over row perspective, taking heavy weights and doing rows, bent over rows, I have about 90% of the strength on my left side as I do on my right. So not 100%, but pretty good. Pull-ups are probably the biggest challenge for me now. I used to do about 15 reps per set. The other day I tried them for the first time, and I hadn't done them again in 8 weeks. And I did 5, but I did have some discomfort in my elbow. And that's really the only thing that I'm noticing discomfort with was the pull-ups in general. For the most part, I feel great. Like my arm feels great. I'm able to do pretty much everything that I was doing pre-injury, okay? Again, it is my non-dominant hand, so I haven't tried using a screwdriver, for example, which might challenge that supination strength. I haven't tried doing that, but I can do pretty much everything that I want to do comfortably without any sort of discomfort and feeling good. And so I got the softwave TRT therapy. I did that for about 6 weeks, the first 6 weeks after the injury. That really helped. I haven't done it in several weeks since then. And on top of that, I also have been taking proteolytic enzymes, which are enzymes that go in, they break down scar tissue, they reduce inflammation. So I've been taking proteolytic enzymes. I've also taken peptides, particularly one called BPC, Body Protective Compound 157, a peptide that really enhances tissue healing. So I utilize that as well. And then I also used pulse wave red and infrared light, something called the Kinian Move Plus Pro, which is designed for joints to help enhance blood flow into the joints, enhance healing processes, stem cell development, nitric oxide, which increases oxygen and increases tissue healing. So I was using that, particularly the first 4 weeks I was using it. Really stopped using it after that, after the symptoms went away, and I just felt like I was getting good function out of the joint, and I stopped using that. And I would say my recovery has been amazing. I would say overall I'm about 95% recovered here at 8 weeks. I look forward to seeing my recovery get close to 100% within the next 4 to 6 weeks. That's kind of my expectation here. So, I'm just a simple case study. I'm a healthy individual, 42 years old, healthy male. It was my non-dominant hand, which I think does make a difference. Obviously, I use it for less like fine-tuning types of things. I wouldn't use it for a screwdriver anyways, or to open a can, something where I'd need maximal supination strength. So I'm a simple case study, but for me, not getting the surgery was the right thing to do. It improved my recovery time, obviously saved me a lot of time, money, potential risks that come with the surgery. I'm very, very happy with my decision not to get surgery on my distal bicep tear. Very happy with the decisions I made when it comes to progressing in the healing process. So if you're out there, you're dealing with it, again, take my information and look at it yourself. I'll have the studies below this video so you can look at that and take everything into consideration. Your job, your age, all of those types of things. Most surgeons will say, if you're over 60, don't get the surgery. If you're young, get the surgery because that way you have the best chance to gain maximal function. That's what they typically say. For me, again, I consider myself young. My surgeon recommended, or my orthopedic recommended it. I chose not to, and I'm happy with that decision. And so, again, take this video for what it is, take the resources for what they are, and make the best decision for yourself. Hey, if you enjoyed this video, be sure to check out my channel, browse the various videos that I've done on similar topics, and also make sure you subscribe to my channel and hit the bell button. That way you get notified whenever I put up a new video training. Thanks so much for being a part of our community here, and I really hope you enjoy the videos that we're putting out on a regular basis. Be blessed.